Great. So thank you, Maya, for taking my call. It was lovely to see you on Wednesday. I wanted to just have a chat about what you kind of learned on the day and your experiences so far.
Yeah, absolutely. Well, thank you so much for letting me shadow you yesterday at Square Mile. It was wonderful. Actually, it was really good that I came to shadow you because you had a really challenging case.
Yes.
So actually being able to see how your workflow is for managing difficult cases was great. And on top of that, obviously you're using this VS Flexi file system. So it was nice to see how you actually like manipulate the files and how you use them firsthand. So that was very helpful.
Exactly. And so you qualified in the Eastman, so you are well versed with your stainless steel files.
Yeah, you'd say so. Yeah, that's true.
So I think this was an interesting one because I went through the same process as you. And I think after you finish the whole course, it's like you get an absolutely fantastic education on all the theory, and you learn how to be patient. And but then there's a whole new world that opens up about all the different kind of commercial systems that are available to increase the efficiency of how you work. And I think yesterday was a really nice example of a case where if you were reliant just solely on stainless steel hand instruments, like technically the challenges would have been really immense.
Absolutely. I mean, we were talking about this after the case, weren't we? And we were just saying, like, if you'd just done that kind of using just hand files, there was a high chance that you were going to get heterogenic error in this situation. So
exactly. So this was the case that that we had. So it was a lower right 7 with a really acute curvature on the mesial root. So this is a tale of two roots, whereas a distal root, literally a 3004, just drops in straight away to the apex, whereas the mesial root is has got a significant curve. But unbeknownst to us at the start, it's got a significant curve distally, but in the last 2 millimeters, there was also an acute curvature buccally as well. And it's that third curve pretty much that's the killer curve, and that's where in a way the hand instrumentation and all the kind of techniques that you went through in Eastman of learning how to manipulate the hand files, that tactile sensation is invaluable. But then you have to use that information and try and say, okay, how are we going to actually manage the case then that's in front of us at the moment? So when we started this case, I started with the file 6 just to see where it wanted to go, and I couldn't get patency in that. So I started then to do like a coronal flare above that. So you were probably able to see better how then I took it then on the next step after that. So once I couldn't get patency, what did I try to do?
So, you were using the glide path files, so your 1304, your 1704, and just kind of using that crown down approach to just slowly let the file, ultimately it's like what the canal can give you. So wherever you were feeling resistance, you were just using those files to gently widen the canal to be able to get further and negotiate further apically.
Exactly. I think we all have we want to race down to get to the apex straight away, but it's like, and that's where the tactile feel comes. So once you feel there's a lot of resistance on the file, I was just stopping and backing out and trying to open it up a little bit coronally. But at the same time, you're trying to preserve a lot of the pericervital denting, whereas in the past, we would try and get straight line access to the first curve. Now we're just letting the files feed down into the canal. And because they're so flexible and so small, they can get much deeper into the canal system than if we were using kind of bigger, fatter, stiffer files.
Absolutely, absolutely.
But I think that wave approach is really nice, and having ideally have it set up where you have multiple hand pieces, where your nurses are changing the files for you. That saves so much time, and it can make your workflow really, really, really efficient. But I think the crucial part in this is in this last kind of 2 to 3 millimeters. I think there's lots of kind of flexible systems that will get to, let's say, 3 millimeters from the end. It's that second acute buccal curve that really was the most difficult part of the case. And it's again in this case, like the 1304 wouldn't go to length initially. So we had to do 6, 8, 10, and then with a loose 10, then the 1304 could get to length. But if we tried to bring a 15 file around there, I think at least in my hands, I absolutely am sure that I would have started making iatrogenic problems. Whereas the soft metal of the VS flexi system in this case allowed us to go around and take that second double curve, but still remaining centered in the canal and keeping patency all the time.
Absolutely, absolutely. I mean, I think one thing that you probably like, it's just to me really valuable in a case like this is just making sure that you have that glide path, like using your manual files, particularly your small sizes, 6, 8, 10s. In this case, it was so invaluable for you because you could actually look with your size 6 and see that other plane and see that other curvature.
Yeah,
So,
exactly. So it's like that was one of the first things I did when I took the size 6 file out. I just really kind of, because I expected that first curve, but I didn't expect it to be so difficult to get patency, because even on the really curved canals, generally the size 6 can go down. So when you're kind of feeling resistance, then you know that there's something else out of the normal is happening as well. And it's really important if you can then mentally engage that and be able to see the direction in your mind's eye when you're doing the instrumentation, then that helps plan you. Because one of the questions you asked me was like, what's my protocol for these kind of cases?
I did. I think it's just like, to me, it's because when I was at Eastman, everything was very much like, you know, this is how you should try to follow a pattern because there's a logic behind it. So, and even when you're starting off with like the VS Flexi, I think you should kind of initially, as you always told me, like start off with following the protocol. And then once you understand it, then you can slowly adapt it.
Exactly, yeah. Exactly. And I think it's I mean it takes for any system that you do, it takes a little bit of time to get to know the field, to understand what the files can do, and then you can adapt that into your routine. And I think part of the glide path management, it's so important. So I mean, no matter what system you use, it's like even if you just use the path files and you want to finish on any other system, I think having those path files available at least to you. You don't have to use them in all the cases, but having them available to you makes such a difference.
Absolutely.
Because nobody wants to be in the chair for hours and hours. So if we can do something, because I mean, at the end of the day, you're just trying to make a pathway to the apex. You can do that in 2 minutes, or you can do that in like an hour. It's like the length of time that it takes to do it isn't the kind of critical thing. Then once the glide path is made and you've got the canal shaped, then you can start thinking about your irrigation and your kind of biological activities after that. But the actual mechanical procedure of getting to the apex, there's no real advantage in taking a long time to do that.
No, you're right. And you were saying yesterday as well, like this case would have been so great for Irreflex.
Yeah, exactly. And it's so it's like when you have a metal needle in a case, let me just share my screen again here. It's so when you have a metal needle in a case like this, literally it's going to get to about here. So it's like we know from most of the studies that you're going to get fluid exchange maybe a millimeter or two beyond that, where if you can use your Irreflex system, you will be able to get, so we opened it up to size 20 apically, even around that second curve. So you'll be able to get your Irreflex right down to within about 2 millimeters from the very bottom of the tooth. And that creates then huge advantages in terms of the efficiency of replacing the irrigant in the apical part of the tooth, of bypassing any of the vapor lock that's going to be further up into the canal, and just having that dynamic irrigation where you get the kind of crucial part of the system clean. So this is what our kind of final result is. And even on when I looked at it at the start, I was kind of hoping, because often in these really curved routes, the canals meet a little bit higher up, but in this case, they were all completely separate right down to the very end. And there is little bits of communication between them as well, but it's but the key is actually this last 2 or 3 millimeters where the root became buccally. Even if the canal ended here, that's not that difficult a case, and we get that we treat cases like that a long time, but it's that last little curve that was sharp that's what made that a case that's not normal. But also I think one of the couple of the things that we did it's like when I was using the 1304 and the 1704, I didn't use it just in rotation all the time. So when we were coming around to that last bend, sometimes I would reduce the speed on it. I would use the tactile control activation, where I would place the file passively into the canal, see where it wants to engage, and just rotate it and gently come out, rotate it, gently come out. And that's the key to be able to because the tip of the small path files especially they're very flexible, but you also have to kind of use them with care. So you need to place them into the canal in the right way. And then if you do that and just engage it and come out, it's a little bit slower than using it just in rotation, but it's a really, really safe way of negotiating the difficult anatomy.
So what RPM did you reduce it down to roughly?
So on the last bit, I went down to, so in the earlier part, I was using 350. And then in the last little bit, I reduced it down to 250.
Okay. Yeah.
But the speed, I don't think is the crucial part. I think the crucial part in that is kind of feeling where the canal is, feeling how much resistance on the file before you take it out, and never to push it. I mean, it's like with that, it's like you're literally just engaging out, and that then it just makes such a difference in time. Because I mean, if you had to try and instrument a system like that just by hand files alone, and even if you were able to manage it without doing any iatrogenic damage on it, I mean, we'd still probably be there trying to do it.
Yeah, I agree. No, that's really good. That's lovely. It's such a nice result.
I think then just the last other thing then that we did is we used the non-standardized gutta-percha cones to obturate it. And that just means that you can use the non-standardized cones. The idea behind them is that you're not going to get taper lock higher up in the canal, so that you don't have to do a massive coronal flare. So you can see when we look coronally on this, I mean, there's a little bit of coronal flare there, but it's not excessive. But if you were to use a lot of the other kind of stiff file systems, you would do a big coronal flare where you remove a lot of tooth structure. And this tooth's already compromised having such a large restoration. So if we can minimize that, the amount of tooth structure loss in this area, hopefully in the long term, it'll help reduce the chances of having root fractures and kind of adverse iatrogenic issues on the tooth.
Mm-hmm.
But having the narrower cones means that we can get we can gauge the canal and get get some tug back on the GP in the area. I injected the bioceramic sealer into one of the canal. It came right through the system and out the other canal. And then you're confident you can place the gutta-percha to length, and that the gutta-percha is actually almost acting like a plugger rather than actually creating the seal. And that's one of the big advantages of using the bioceramic cements, is that as the set that don't shrink, whereas virtually all the other sealers will have some shrinkage on setting.
Yeah, absolutely.
But it was it was an absolute pleasure to have you with us. And it was nice to it's nice to get someone young and enthusiastic who's just kind of continued on, just finished their training and wants to continue on improving. And I think you're going to do fantastically well.
Oh, thank you so much. It was, honestly, thank you so much for that experience. It was really good.
Good. No, thank you so much for taking the call, and I'm sure we'll see lots from you in the future.
Absolutely. Thank you, Daniel.
Thanks, Maya. Thanks.